like to ask this question. It's a clinical question. What does your child do that makes you know she's smart? He or she is smart. And it gives, I don't use this with all children, but I do use it a lot. And the reason I started using it, I worked for a number of years at United Cerebral Palsy, giving speech and language, bilingual speech and language therapy to kids with all kinds of true cognitive disorders, syndromes, very serious CP, but a lot with severe cognitive impairments. And I'd ask this question of the parents, and the parents would always have something, a story as to why their child is smart. Even children who might be 3 and 4 years old, functioning lower than the 12-month level, lower than the 6-month level, they'd always be able to tell me a story. So there was a little girl that I worked with, Diana, and I was asking the mom, how do you know Diana is smart? And what this mom said, she said, I know because when her daddy's coming home, she hears the key in the door. She turns her head to the door and smiles because she knows daddy's coming home. Cause and effect, 3 to 6 months. But it was a true wonderful example that mom gave me that I could incorporate into an evaluation that would tell me exactly what that child was doing. If you evaluate kids who are cognitively have more moderate to severe cognitive impairments, often they're not going to do anything in front of you to show their highest strength. You've got to use the parent interview to get that, or the teacher interview if they're in a preschool. What progress or regression has happened in the past 6 months? When you're dealing with EI evaluations, and here preschool evaluations, often the kids are referred, but then by the time you see them, they're fine. And way too often the mom will say, I thought the pediatrician referred me, I was actually worried but now the language is fine, she's doing great, I put her in a preschool, she's flying high, the teachers say she's doing well. If we don't ask this question, we may end up identifying this child with a disability just because of the bias and lack of validity in our testing materials. And in fact, the child's fine. So you want to ask this question. Regression is another thing. Of course, those of you who are trained evaluators know that there can be sicknesses that happen. There could be various environmental toxins, lead poisoning, meningitis, head trauma, shaken baby syndrome, things that can actually happen. So you want to find out if there's been regression. I recently reviewed a progress report, an annual progress report of a little girl who was in a preschool, and this therapist had seen her, I'm not sure, but I'm not sure the therapist's credentials, they weren't on the paper, but there was two sentences that said, maybe 3, that said, the child has made progress in vocabulary, language, paying attention, and something else. And I was like, well, of course the child has. You didn't have to do anything all year, and unless the child had some major trauma, that would happen because kids grow up and mature. So what really did you do? What really was the progress that the child made? Where was the functional level a year ago, and where is it now? Don't give a test, obviously, for a progress report. If you've seen the child for a year, you're the expert. Tell us what this child's doing. This critical question I started using about 2 years ago, and I find it to be one of the most important and effective ones for my report writing. It is when I make the appointment with the parent to do an evaluation. I say, well, okay, we're going to see you at Tuesday at 3, and I call them on Friday, or whenever I call them. I ask them to write down 10 examples of their highest level of communication. Now, the ed evaluator, psych evaluator, and speech can all use this. I ask them to give me examples of where they show they're smart in their play. And then what happens, the parents, I ask them to give me 10, and where the child breaks down. But really I'm looking for where the child's highest level of communication is, or problem solving, or play. And what happens is, I've never gotten a parent to bring 10, but I've had many parents bring 5 and 6, and everybody has brought at least 3. And here you have this information of an example, a picture of what that child does at the highest level outside with their parents who know them the best. So when they come to that little room or wherever you're doing it, they actually, or even in their home, but you're breaking up the normal flow of the home, that you actually have information of that child in life, communicating, problem solving, playing. And I use many of those examples as my holograms, which I'll talk about in a little while, that really show the readers of the evaluation that child's functional level, what they're able to do. One thing that I wanted to say is in some evaluations, what we have is the evaluators will write down what the child says while they're perhaps interviewing the parent, or they'll watch the child play. But really, what we're looking for in evaluations is not just examples of the child saying, oh, stop that, I want this, whatever they're saying. You want their highest level of communication. And I see way too many evaluations of 4-year-olds that just write down what the child said during play, when there's no, you want to have that linguistic system stressed, meaning the child wants to communicate something really complex, something really important to them, and they use their best language skills to do it. That's what you get from the 10 examples. So as you're doing your evaluations, don't assume that a language sample is just going to be writing down what that child said. You want it where the child is stressing the communication system, or you put some toys out and the child sort of does or doesn't do them. What about when that child really is playing hard with a friend or a peer, or a brother or sister, cousin? What does that child do then? Wow, look what this child did in this example of playing in the kitchen or blah, 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 whatever. Look at this great toy this child made.